Welcome to Mazars Africa Talks Online. I'm Estelle Youssoufa. I'm very glad to be with you today. Our special guest for this discussion is Vera Songwe, the Executive Secretary of the Economic Commission for Africa, the ECA, which is a UN body promoting the economic and social development of the continent, intra-regional integration, and the ECA also promotes international cooperation for Africa's development. Obviously, we'll be talking about the COVID-19 crisis on the continent, how to attract investors, how to handle confinement exit strategies, and how to restart the economy. Thank you so much, Vera Songwe, for being with us.
Happy to be with you, Estelle. Thank you very much for having me at Mazars. Thank you. My pleasure.
And to kick off the discussion, let's hear for our very own special and unique Abdou Diop, the managing partner of the consulting firm Mazars Audit and Conseil in Morocco. Abdou, what kind of support is the private sector expecting from such institutions like the ECA?
Thank you very much, Estelle. First of all, let me thank a lot Vera in this busy time to take her time and come exchange with us and with all our followers about what's going on in Africa across the COVID. Thank you so much, Vera. And I know that you are totally committed in this pandemic to help Africa to get out of this situation. So today, I think that in Africa, we have had very good answers on the pandemic concerning the sanitary area and health sector. There have been many good decisions that have been taken. We have also had some interesting things that have been done to help poor people to access to food and all those materials they need in this period. But I think in all this answer, we are still missing one point, which is how to help the enterprise and the companies to really go through this crisis. First thing where I think that there is a lot of things to do, but still we have not done a lot. It is how to help those enterprises who are in lockdown period to continue to pay their salaries, to maintain the jobs, and to be able to just be healthy to face the recovery. And in that area, some help have been given, but I think for those who are at the minimum wages, there have many things that have been done, but all those companies that are paying people above the minimum wages, there is nothing taken by countries. When we see all the measures in different countries, for example, that population, the middle class, have been left aside, I think. And also, I think that we have taken many decisions of lockdown, but I'm not sure that it was really, for many countries, the good decision. Because when you see what happened during the Ebola crisis, many countries moved forward without lockdown because they had all the mechanism or the measures in the country to allow distanciation and to be sure that the population will follow the good measures. But unfortunately, I think that many countries followed the panic in the Western world and moved to the lockdown in large period. For instance, in Morocco, we are in lockdown since more than 3 months. In other countries, it was 2 months. And for countries where 50% of the people are informal, getting every morning to have their daily pay, it's complicated to have 2 months, 3 months, and 4 months lockdown. So perhaps we have each country was left alone and took a decision just following the movement in Europe, in the US, the panic movement. And perhaps it would be different if there were decisions taken at regional level or at continental level. And when we see, I think we have the chance, Vera and UNECA was perhaps the first multilateral organization that took the decision to put people together and to try to find solution. But in the beginning, really countries were left one by one. And so many decisions that could be taken at a regional level were not there. For example, lower the interest rate to have more liquidity in the market. That could be a decision at a regional level, at a global level. But that decision was not taken. So countries were trying, each of them, to manage by their own. So I think that in the health response, we have had really good decision, good reaction, because I think we are used to, because of the historic of the pandemics in the continent, to help the poor. Also, we are used to, because in many countries also we have politics that are used to help the poor when elections are coming. So we know how to deal with that. But really to see how to help companies to move forward, to go through the crisis, and how to help sectors to relaunch the sector to have recovery of the economy. I think that in that part, we need more and more collective action at the regional level and at the continental level. For example, and I will stop there, today everybody is talking about tourism sector, but there is not really a global coherent decision at the African level to see at what moment the air traffic will open. And that's an issue, because if, for example, West Africa decides to open air traffic for tourism and the other countries don't do it, it won't work. So we need really, for many issues, to relaunch the economy, to have global responses. And there, I think, we need the help of multilateral institutions. And thanks to you for what you have done since the beginning of the pandemic, because we have the chance to follow all these meetings involving the private sector. And I think that's what we need, really.
Wow, Vera, it seems that you have a lot on your plate. The private sector is actually pushing and championing your action, but you've been very busy. Can you tell us what is your assessment of the COVID-19 crisis on the continent, and what are your perspectives on Africa's growth?
Now, thank you, Estelle. Of course, Abdul, thank you so much for that sort of mise en scène, if you want. I think three things. First of all, to say that we are living through an unprecedented period in the history of Africa, in the history of the world. We have not seen a crisis like this in a century. A combination of a massive, health crisis, and of course, what is, considered by many a depression, a recession, slowdowns in growth of -6% in Europe, an average slowdown in world growth of -3%. So this really is, a global public bad in some sense, right? And what we are trying to do now is to say, how do you come together in the face of this sort of, what we will call co-movement? I mean, everybody's going down, it's sort of, normally if a few are going down and a few are going up, that's how Africa survived the 2008 crisis, because China was not going down so fast. And so China continued to pull us up. And so we didn't go down as fast as everybody else. But here, everybody's going down. Our major trading partners, the United States, Europe, and of course, Asia, and in particular, China, are all markets that have been affected or even were affected before us. So even though the wave for Africa was coming late, our markets were already affected. And so markets started shutting down, and so for Africa, and I think that is maybe why ECA was the first to, or one of the first to react, is because we saw the economic impact even before the health community saw the health impact, because as China shut down, then Europe shut down, then the United States shut down, our planes were on the ground, our hotels were closed, we couldn't import, we couldn't export, the flower exporters from Uganda and Kenya and Ethiopia could not send their flowers out. Thank God in Ethiopia, because Ethiopian Airlines continued to fly, the growth in exports of flowers from Ethiopia out into the Europe went up by 80%, and this gives you a sense of the displacement of markets, because normally Ethiopia was maybe 15% of this market, because there was Uganda and Kenya and Tanzania also exporting flowers, but because all these markets got shut, and because Ethiopia was well prepared with Ethiopian Airlines that was doing the cargo, the Ethiopian flower producers could export everything. But really, I think this economic impact, the second thing that happened was, because we were having these waves of closures, and then people realized, oh my God, we may have a crisis, we got people shutting their borders to commodity exports. So, we got the East essentially saying no more rice going out, Europe saying no more drugs going out. Africa imports almost 95% of its drugs from Europe. So immediately you get a tension there that comes up that says, what do we do with this? And so I think what we decided to do was to say, let's look at, and this is sort of maybe going to answer a little bit your question around, what is the reaction and how can we.
Hello.
So the question was, if you manage to begin, and this is where I think there has been collective action. First of all, the African Union came together and called the health ministers. When we heard a health crisis was coming, there was an immediate meeting with the African Union and the health ministers. And as you said, from the Ebola times, we have learned a little bit. Lessons from Ebola, but this is not Ebola. Ebola was sort of contagious, but not exponentially contagious as this is. Ebola was a little bit visible in its appearance, right? Here, we're talking about asymptomatic people who eventually can, transmit, and then the person that they gets it becomes symptomatic. So I mean, we did not yet understand the very nature of the virus we were dealing with. On the one hand, and I think that the guidance that we were all getting from WHO was immediately the easiest way to treat this and to manage this was to physical distance, was to ensure that people do not come in contact with another, because we knew that the virus was transmitted with contact. Did Africa just copy the rest of the world? No, I think that up until today, the guidance from the CDC and amazing work that the Center for Disease Control in Africa has done has been, let's distance each other, let's stay away from each other. And because our communities, particularly, Africa has a huge urban concentrations. So it became very difficult. You cannot control something like that if you don't then, go into lockdowns. We had a choice, and the Minister of Finance and Development of Egypt put it very starkly in those early meetings we had with her. She said, we have a choice between people dying of hunger or people dying of COVID. Because exactly as you said, 60% of our economy is informal, which means people live on a daily income. They have to go out and they have to sort of make their income for that day. But even in the United States, there where people don't live on a daily income, they lock down. But lockdowns are difficult. It doesn't matter. In Mexico today, there's a big conversation around, should we be locking down the city or not? We are by nature as human beings, active people, right? We want to be productive. Whether we want to be positively or negatively productive is a different story, but we do want to be, we want to be productive. And so I think that has been the tension. It's been the cost of treating one sick COVID patient versus the cost of keeping people at home for an extra day. Now, if you're the United States and you keep people at home, it costs you 40 million people unemployed. You can give $2.2 trillion injection of fiscal stimulus. We're now at $6 trillion of stimulus in the United States. We cannot afford that on the continent. The Economic Commission for Africa has done a study that shows that for every month of lockdowns on the continent, it costs us somewhere in the order of $65 billion. We cannot afford it. So I think, we immediately, but it was important to do the lockdown because we needed to understand the extent of the problem, the geography of the problem, and the science of the problem, and then begin to say, and people needed to understand something important, something difficult, something drastic was coming to us. And I think in Morocco, for example, you locked down, if my understanding is correct, and then maybe opened up too soon because of the economic pressure, and then the numbers went all the way up, and then you came back in. And so I think people are going to understand how to moderate. In Senegal, there was a complete lockdown, and then the president decided, well, let's just lock down Dakar and Touba, and we'll open up slowly. So I think what we're going to see now is sort of differentiation and moderation and adjustments in the lockdowns. But I think it is unquestionable that social distance is the easiest way, particularly when you come from a continent where we don't have the resources, the hospital capacity. We have 1.8 beds per 1,000 people on the continent. In Italy, they have 570, and they were still struggling. So we had 1.8. So we cannot manage, the crisis if it hits us in those ways. So I think lockdown was a good thing to give us time to prepare. People are now saying, oh, look, Africa is prepared. Africa's numbers were at 300,000, right? With about 8,000 deaths. So we're very, very, those are important. 8,000 deaths is a lot of people. But compared to where, just yesterday, Arizona was at 4,000 deaths, right? So when you look at it in those magnitudes, I think that people say Africa is doing well. But one of the reasons, I don't know if we're doing well, we have clearly slowed it because of the policies that we put in place. Now they've cost us an incredible amount in economic terms. And we need to now understand how is it that we manage that. So we're working on issues like cross-border to allow for food and agricultural commodities to continue to cross borders, because that's where a lot of our SMEs are on those sort of cross-border agricultural trade, to make sure that there is some livelihood that continues to happen. Of course, the multilateral development agencies have injected a lot of resources in that hopefully are going in the way of social safety nets to sort of reach the most difficult. But then, because again, we know that 70% of Africa's economy is informal, we don't know where to find them. One of the things that ECA has just launched yesterday, actually, is an information platform, is the Africa Communications and Information Platform, which essentially, at its best, will have about 714 people on this, 714 million in the, cell phones on this platform, where we can talk to them and understand, are you food deprived? Haven't you eaten for 2 days? Do you need immediate assistance? Because the problem that we have is, because of our informality, most of these people are not on any registry. The poorest of the poor, we know them because the government has been giving them assistance. Those who are slightly higher, we know them because they are on government books, they pay taxes, or they are employees and all. But that vulnerable informal sector, we don't know them. And those are the ones that have really fallen into poverty. And I usually give the example of a woman who maybe used to sew in the market, and her husband was a rickety driver or a transporter, neither of them with any sort of licensed establishments. The markets have closed, so nobody's going. And the circulation is closed, so nobody's using any transportation. So these two people, who more or less used to be above average and not poor, have now become very, very poor because they have zero income. How do we reach out to them? And maybe they're a family of 2 or 3. So they also have the kids who used to go to school in the day and were fed at school because schools used to give you a school lunch. So there is a sort of dislocation of the economic fabric that we need to try to build back. Now, I think you raised the question, Abdu, about the SMEs. I think one of the policies that we must focus on is to make sure that our SMEs don't close down altogether. Because for the Build Back Better story, we're going to need them. We can't create new enterprises in 1 year, right? And we know that out of every 10, 7 will fail. So the best thing to do is to make sure that those who have proved their concept, those who have been in business for 7 years, we should make sure that they can stay alive. So on the private sector side, ensuring that we inject some capital into those businesses is the best way to go. And we've seen in the developed world, but even in places like in Nairobi, in Kenya and South Africa and Morocco, some subsidies going to businesses to keep their staff on and not fire everybody so that they can come back. I think those are the kinds of things that we will want to put in place to make sure that there is at least some semblance of an economic tissue on the other side that we can use to build back.
Thank you, Vera. You mentioned Europe and the US with depression/recession. What is actually your perspective for Africa's growth?
Well, the continent was not doing well before. I mean, some people would say it was because we were coming from 2.4% growth in 2019 to 3.2. So some people would say, oh, the continent turned around. No, well, 3.2% growth is not anything to write home about. We need to be growing at 10%. But we were at 3.2. Initially, we thought we will go down from 3.2 to 1.4. But now, realistically, I think we will be lucky if we just had 0% growth, if we were flat and didn't fall into negative territory. So we really hope, I think that we have run 2 or 3 scenarios. If this is, there is a conversation now around this economic recession being a Nike shaped, which means that we stay down for long and in a contracted period, and we don't go back very fast, because, the U shape means you sort of pick up very fast, but Nike means, you sort of take a while to get back to where you were before. We cannot be aiming to get back to where we were before, because where we were before was nothing to write home about. In East Africa, though, we were growing at 7, 8, 9%. Rwanda was even looking at its projections growing at 11% this year, and Ethiopia was planning to go to 9%, and Kenya 7%. So East Africa was actually having quite some robust growth. And so we hope that they can go back to that. But clearly, again, East Africa is a more tourist economy. So they've been exposed to the sort of most painful part of this crisis, which is the lockdown on transport, on services. The sectors of the economy that are suffering the most, of course, are tourism, recreation, retail, construction. So the contact sectors of the economies, which is a lot of our economies, logistics. And so, we don't have a huge financial sector basis where you can work from home and manage the markets. Morocco, yes, maybe to some extent, South Africa to some extent, and Cote d'Ivoire. But most of us, and mentioning Cote d'Ivoire, the other thing that we're going to be looking at is the more diversified the economy, the higher the probability that they'll be able to come out of this much faster than, and then finally, of course, the issues around technology. The more technologically linked, technologically savvy, technologically accessible, technologically affordable economies are, the higher the probability that they can get out of this faster as well.
Now, Vera, coming to what Abdou mentioned regarding travel and air transportation opening borders, we see that the air companies, the African air companies, are in big trouble. If we look at South African Airlines, for example, it was already in hot water before. Now there are big question marks about the very survival of South African Airlines. Same with Kenya Airways. You mentioned Ethiopian Airlines, which had managed to transform and adapt to the situation to become, in a way, an engine of survival for the Ethiopian economy. There's talks around Royal Air Maroc here in Morocco, who the national company is also in trouble. How do you see this very critical strategic sector for the African economies getting through this period?
I mean, the sector is clearly in trouble. When we did our report, and ECA has done a report where we have a segment on the airline industry, I think we came out with numbers of around $4.4 billion of what is going to be, of what is being lost and going to be needed to make sure that the airlines stay alive. In Europe, we have seen, 11 billion to Air France, 5 billion to Lufthansa. The United States, I can't remember if it's 50 or 500 billion to the sort of overall airline industry in terms of government support to these airlines. I think what we need on the continent is something similar. It's a little bit, there is no private individual that will come and put equity into an airline company today. So it has to be the public sector that injects some new capital. Most of these companies anyway are to some extent, if not fully owned by the state. So what we're going to need is some state injection of new capital. Again, some of the fundamentals need to be right. And as you said, South Africa probably needs some deep restructuring for its fundamentals to become better. Companies like Ethiopian Airlines have been amazing because they've been able to refurbish. They've become cargo airlines. They service the rest of the continent on the cargo side. So they're not doing, we wouldn't say that they're not suffering, but they're doing a lot better You know, they're even servicing Argentina, they're doing the drugs, they're doing the humanitarian with the UN. So they've managed to sort of repurpose themselves almost into a cargo airline and a service delivery airline. But I think that's again where we need additional resources from the international community to be able to inject them into these airlines. Air Cote d'Ivoire, Air Senegal, Air Maroc, Egyptian airline is the second largest. They are also suffering. So I think we will need to understand, you know, how we provide resources to governments, and that's where we're doing, ECA is doing a lot of work to see how, one, we can leverage the markets to raise more resources, but also do advocacy to institutions like the World Bank and the IMF, so that some resources are provided that can go into refurbishing or at least keeping this. Remember, I said, you know, this is not the time to try to create a new business. It's the time to make sure that the ones that we have stay alive first. And so, you know, we need to keep Kenya Airways in the air, and then we can think about something else a little bit later. So I think that is the framework within which we are working and trying to see how we, you know, shore up the present so that there is something to build in the future.
Talking about investment, the COVID-19 Africa Innovation and Investment Forum 2020 closed a few days ago. You hosted it online, remotely, and the ECA showed mentioned some priorities, which are science and tech. How do you want to accelerate investments in those sectors? Obviously, they have been perceived and understood, widely understood. Some anticipated that years ago, but many, you know, the point reached home for many that science and tech are key for modern economies. How do you want to accelerate investments in those sectors?
I think two things. The first one, and I have probably been quoted as saying this already, is the easiest way to accelerate investment in some of these sectors is to improve the policy environment. So first of all, governments have to put the right policies in place. We have to have competitive sectors, particularly if you're talking about technology. We need to have a competitive technological space where it is affordable, where broadband is easily accessible, where you have the right bandwidth that is going across the city, and that the cost of it is not prohibitive. On the technology side, it's first of all education, right? We need to begin to relook at our curricula and to ensure that, you know, the studies that we are putting through our kids through are the right kind, and that then there is opportunity. Secondly, you know, creating a business. I mean, there's so many young people out there that are willing to create an app, or, you know, the beautiful thing about technology is that sometimes you don't even need a lot. You need a hub, you need a little bit of a space to sort of test your ideas. But what you need most of all is the policy environment to allow you to be able to do that. And so, for example, on the continent, you know, we don't really support innovation, because what we do is we make it so expensive to patent an innovation. So if you're a young Kenyan, you know, it costs you $3,000 to license an idea. I mean, no young Kenyan today has $3,000 to license an idea. So if you had Google or Facebook or anybody fly into Kenya and give them $10,000 for the idea, they'll sell that idea tomorrow. But this idea may have been worth $1 billion. We will never know. And so one of the things that we are also arguing about at the ECA is to push for intellectual property rights, to see whether we can, as a continent, federate innovations and have a sort of repository where, you know, the young kids could go and do that. The other thing that we're doing is help them provide the space. So we did a hackathon in the conference that you're talking about. We ended with that because we want the youth to be able to, one, you know, there's a lot of sort of shared platforms, open design and open innovation. So we want to bring kids from across the continent together, and they can share their ideas and discuss them and co-create and co-produce. And we believe that, you know, they need this platform to be able to interact in a way that is safe, secure, but also provides the kind of bandwidth that they need to design their apps in a secure environment. And I must say that in the beginning, we struggled a lot because we thought, how do you do a hackathon in the middle of COVID with somebody in Zambia and Zimbabwe and Algeria and Tunisia? And it wasn't clear, but it actually turned out well. It turned out quite okay. And we had 194 submissions at the last time I checked, and with some amazing ideas coming out of it. And we hope now that we can go raise some resources to build on those ideas.
A mention regarding the health sector. You mentioned the dependency of Africa on, but it's the same for Europe. Most of our medicine is now produced in China, in India, as well as in Brazil. How do you see Africa building or rebuilding? Because some remember that it had existed before. How do you build an African pharmaceutical industry or rebuild it?
And it's a fantastic question, and I love that question because it's one of my passions. I'm just laughing. We did a study about a year and a half ago, 18 months ago, looking a little bit at the health sector of the continent. At the time, the idea, of course, we're economists, so we were looking at sort of how do governments on the continent with the demographic dividend fund healthcare. We realized that a huge part of healthcare on the continent was the sort of purchase of commodities, and we were spending over $14 billion importing. By commodities, I mean syringes, drugs, gloves, whatever, basic things, swabs, and so we thought, maybe what we should do. So that was the first sort of discovery for us. The second discovery was that when you came from the small island states, Seychelles, Djibouti, the smaller countries, it was much more expensive to procure pharmaceutical products, and in some cases you could not even, because Seychelles is too small and too far and nobody really wanted to deliver there. So we started sort of testing out an idea of pool procurement for the Horn of Africa. We had about 8-9 countries that had come together and signed an agreement that said we will buy in bulk, and we decided to look at the sort of maternal and child care category of drugs. Turns out there is a woman in Kenya who is a pharmacist herself, owns a pharmaceutical production company, and can produce these drugs. Is certified. There is somebody in Uganda who's actually been producing and selling to the Gavis and the global funds. And so we discovered this amazing trove of African business people. Of course, in Egypt, you have a huge collection of pharmaceutical companies. Kenya. Ethiopia is beginning to open a few. So we thought to ourselves, but then why are we importing so much? When, $14 billion worth of imports is about 6 million jobs. So that is the amount of jobs we will sort of export. Africa cannot afford to sort of, import jobs. We have unemployed people on the continent. So we actually started working on this idea. Then COVID came. And so what we've done is we've moved a little bit to work on the PPEs and find Africans that can produce the PPEs. But we hope that we will go back to that idea and ensure that we can create, in the context of the African Continental Free Trade Area Agreement, actually, because then, if the Kenyan can produce the drugs and sell them to Ethiopia, Djibouti, that really is the CFTA in action as well. So we get three things. We get Africa producing the pharmaceuticals, we get the CFTA working, and lo and behold, we get women getting the right drugs, because another problem in the drug space is the counterfeit issue that we are also planning to work on.
So you heard it on Africa Talks Online, perspectives in the health and pharmaceutical sector. You pushing for it, it could happen. And then that was, mentioned by the by, but the CFTA is still alive.
Yes.
Many have doubts. Yes. Many have doubts. So I'm glad that you raised the issue. Tell us, Vera, where are you at with that?
Well, when we began the year, we were all very excited that we were going to launch the CFTA July 1. That was the date, and everybody was working very hard to finalize issues around rules of origin. Countries needed to provide to us their offers, which means essentially the goods that they were going to sort of put into the CFTA basket. Sometime in, I think, end February, we would say that we had gotten almost 50% of the countries had provided their offers, and we were working very hard to close on it. But then COVID happened. A lot of this is negotiations, right? And you have a long process of negotiation. However, those negotiations, because I think COVID has lasted so long, have continued, and we're very close now. We may be at 7 or 8 countries that have not provided their offers. So really, I think so. My understanding at the last technical meetings is that the heads of states have agreed that we will just reset a new date for the launch. So it's been postponed a little bit, but it's going to happen. We're going to launch it. But I think more important than the sort of public, which is great.
Are you talking about the launch? Are you talking about this summer? Are you talking about this fall? Are you talking about this winter?
The heads of states will decide. We don't know what the date will be, but I think I was going to say more important is actually that because so many countries have ratified now, and because we're doing things like the pharmaceutical platform, we're already in effect practicing the CFTA. So rather than wait for a fancy launch, we are sort of launching which is the part that the citizens of the continent care about is are goods moving? Can I access goods? Can I move across borders? Can we work on, of course, what COVID has done is also created a little bit of tension on the borders because a lot of the cases are happening with truck drivers crossing borders. So we need to manage that process so that it doesn't endanger the trade process. But I think that it's very heartening to see, Ethiopian Airlines flying across the continent, dropping commodities, in East Africa, the truck drivers going from Sudan all the way down into Kenya, Tanzania, and Uganda, Rwanda, Burundi. So they, one of the things that we are actually also doing is on food, working to see whether Africa can produce more food and sell into Africa because borders are being closed. So there is a lot that's happening, I think, beneath the cameras, which is pushing towards the CFTA. And the amazing thing with COVID is just the platforms that the youth have created across borders and across each other to be able to sort of, share ideas and share innovations. And I think all that is sort of building the CFTA in the way that we would have loved to see it in its perfect form.
All very good news. We cannot wait to have the official launch, but as you said, it's happening. So we're impatient. A last word from Abdou to say goodbye.
Yes, to say thank you to Vera, first of all, because it was very rich in insight and we share this positive perspective. I think that COVID showed that there are some issues to deal with, but also give us a lot of opportunity to work between African countries. As you say, we have had a lot of cooperation bilateral between African countries to provide food, to provide health care, materials, medicine, and so on. So it's very rich in opportunities, and I think that initiative like what you are doing, gathering people, gathering countries, and private and public sector are very welcomed and will allow Africans to be more and more together and really to concretize this African Union in the ground, and also the African Continental Free Trade area, for which we are all very happy to see it launch quickly.
It's true that Abdou as well as Vera are very much Afro champions, pushing for the CFTA more and more. Thank you again, Vera Songwe. Thank you so much for your time. You stayed much longer than anticipated. We are very grateful. Thank you for your insight.
Thank you. Thank you very much. Stay safe. We still need to wear masks.
Exactly.
If we have to close down, we may close down again to save the continent. But thank you so much, and anytime.
Thank you so much, Vera. Thank you, Abdou. That's a wrap. That's where we're ending the Mazars Africa Talks Online. Stay tuned, stay safe, and we'll come again soon. Bye-bye.